Hi everyone, this is Dax Francis, motivational speaker, and today is Friday, September 27th, and today's video is going to be a walkthrough of how I place my needles, both the venous and the arterial needle. The venous is what pushes the blood back in, the arterial is what pulls it out of my body. So right now I'm just simply putting in some lidocaine, which helps numb the skin to the pinch of the very large needles. And sticking myself really was the biggest obstacle to me performing home hemodialysis. For the 9 years that I did this treatment in center, I would never even look when they placed the needles. And I always thought that my brain would make it hurt, despite the lidocaine that I'm putting in right now. I never even watched them put that in, but now as you can see, I'm a natural, and it's almost second nature, and I can place the needles better than the nurses ever can. I rarely have a treatment where the needles hurt. And when I did treatment in center, once a week or maybe twice a week, the needles would hurt. And that's just the way it was. I thought it was normal, but it is not. Once I started actually putting the needles in myself, I could feel so much more and know just exactly what was going on with everything. And this is the sharp needle for the arterial site. And there is a difference between a sharp and a blunt needle, and I use a blunt for the buttonhole access, and I have to use a sharp on the arterial because I have so much scar tissue in that area of my fistula. So much that a track won't form no matter how many times I stick myself in the same spot. So I use the ladder technique, and I rotate the sites that I use each treatment. And I'm putting a little pillow under the needle just because the position it's in, it kind of likes to droop. And you want the needles to stay as secure as you can. You don't want them moving around or wiggling. And my pressure in my fistula is a lot better when I have that little pillow. And I'm just going to prime the line and add my heparin once I get all taped up. And it takes a while to learn how to tape yourself, but you want all your pieces of tape torn before you start treatment, have everything ready, so all you have to do is reach, grab, and place. And this is the heparin. This is what makes my blood viscous enough to have dialysis performed. This makes it so it doesn't clot for the 2 hours or more of treatment. And I do this treatment 5 days a week. It's basically a full-time job. All the boxes, all the paperwork, and everything that a nurse would normally do in center, I have to do at home. It can be a very complicated process, it can be very time-consuming, and it can be very overwhelming at first. But once you actually get home and you start to do this yourself, the freedom is amazing. I cannot describe to you the joy I get of being able to choose when to do this treatment, or if I don't want to, I don't have to. I am in complete control. And this is the blunt needle. It doesn't have quite as sharp a tip as the sharp needle, and it just slides right in my buttonhole access. All I have to do is pick a scab off, and it's basically an open wound or a piercing into the fistula. So you need to be very careful if you have one of these to keep it clean and not let it get infected, because that can become a very big problem. Actually, a lot of clinics won't use buttonhole access because of that very problem. Just because a lot of patients have problems with cleanliness. So if you have a buttonhole access, make sure you're keeping it clean the best you can. I've never had a problem personally with getting it infected. So I would try to wash it at least 2 or 3 times a day whenever you have time, just to make sure it stays nice and clean. And if it's sore or tender, just use a little alcohol swab and wipe it off. And right now I'm just going to connect my lines. And the lines have already been primed. It takes about 20 minutes to prime, and I do that before I even start setting up for treatment. You want to use the aseptic technique whenever you are doing anything with connecting or disconnecting or preparing for dialysis. And your nurses will help you learn how to keep everything clean. And you'll see right now when I press go, you'll see the arterial start to pull blood through the tubing. Gets red. And now it will start to go through the dialyzer, and that's the part that actually cleans the blood. That happens through osmosis and the dialysate fluid that I mix for every treatment. And I made a video of that earlier, and you can find that on my page. And now you'll start to see the venous tubing start to get red as the blood comes out of the dialyzer and back into my fistula. It's a little cherry now, and it'll get dark red. And as I said earlier, this treatment is 2 hours or more. But since I do it at home, if I felt sick or something, I could get off early. It may just mean that I might bleed a little more because of the heparin. The heparin is adjusted to the treatment time. So I have planned to have about a 2-hour treatment today, and I've adjusted my heparin accordingly for that. So that's today's video. Warriors, I hope you enjoyed it. It's our experiences that matter. Stay strong, don't give up.